So he's going uninsured for everything else because of that, just because the laws are set up. And that's just a small example of the way government force interferes with the exchange between individuals and companies. So in the private sector, those 2 or 3 steps would greatly change the way medicine is done. And we would find that with, and I called them personal health security accounts or health savings accounts, but those tax excluded accounts, once you put your dollars into it, you can, we don't limit the amount you can put in. Actuarially, if you figure out, if you're wealthy enough and you figure out from my age of 55 till my 2 standard deviations above whatever, 97, I'm going to need, if I put $200,000 in a bank account, the interest on that money will cover a high deductible policy and all my deductibles for the rest of my life, and that's what the actuarial number gets out. You want to put that in one year, put it in. Now, not that everybody can do that, but imagine if some people did. All of a sudden, that's someone no one else has to worry about. And what happens when people save money? Well, savings gets invested. Well, where does that go? Well, investment goes into creating new jobs, creating new medical technologies, you know, and so we start a system of saving, which is not really it's not the consumerism that we have to spend money. When we save in a medical savings account or medical IRA, that money gets put to work to innovation in the market. So, and on top of that, you could use it for your deductibles, you can use it to buy your insurance, and you could choose an HMO, you could choose a high deductible plan. We have to free the market up, and that will dramatically drive and change what's happening in the private sector. Now, how do you solve Medicare? Basically, the first thing you have to do, which the politicians don't want to do, is recognize that it was wrong to start it. Having said that, we've tied everybody into it. And so I don't think you have to, the government has to ration the care for the commitment it made to everyone that's in it today. What they have to do is provide options. And so if you take the same concept of medical savings accounts or health savings accounts and apply it to Medicare, and you say, look, from now on you can choose Medicare, just sort of the way it is, except that we'd get rid of the price fixing, we'd allow balanced billing, we'd allow some things to happen, get rid of a lot of the bureaucracy. But we would invite insurance companies to say, look, we're going to provide 80 or 90% of the average cost of the Medicare recipient as a stipend into their health savings account. If they choose to stay on Medicare, fine, they give all that back to Medicare. If they choose to go out in the market and purchase insurance, they can do that. If they choose to buy a high deductible or an HMO, they can do that. Right now, that choice is only given that a Medicare beneficiary can sign away those dollars to an HMO, but they can't sign it away to themselves. So, actuarially today, it's about $12,000 per Medicare recipient. And there's about 6% of the Medicare recipients are uninsurable. That is, if we give this right to 100% and we don't tell the insurance companies they have to cover everybody no matter what, we say, no, you rate fix however you choose to get your clients, and then you go to them, and 94% of people would be able to buy private health insurance and develop their plans. 6% wouldn't. They'd be uninsurable. Well, fine. They'll have to stay in Medicare, and we'll provide the best medical care we can through the medical care system for them without rationing. What happens today on all the plans is they say if you want to be in the insurance market for the elderly, you have to guarantee issue. Now, we already discussed the problems with guaranteed issue, okay? That's like saying we're going to give you socialized medicine. There's no reason to do that. Medicare was a guaranteed issue. We have it, so we'll leave the 6% or more, whoever chooses to stay in it, in that, and we'll make a free market for the rest. Now, what that will do, everyone that chooses that other plan, the actuaries tell me they're going to save 33%. That when you look at, people's utilization rates and everything else, you're going to save about 33%. But the difference is the government's not saving that 33%. You are in your accounts. And those accounts build over time. And because now you're choosing, do you have to see the eye doctor once a year, 5 times a year, 4 times a year? You're going to make a decision because you're going to either have a high deductible and you pay out of pocket for those visits, but you're covered with your catastrophic insurance policy. And it's just the way it works. Now, and it's better that the individual gets that savings because in the long run, they're shopping for services for cash, which drives down the prices and gets the best value to the best person, and the whole cost for everybody goes down. If only 6% of the population is running on insurance under $5,000 a year, well, and everybody else is running on cash, it's going to drive the market to efficiencies. So Medicare and the private sector are now driving this medical industry much more efficiently for 5 or 10 years. You know, and what do we do for everybody now under 65? And this is too detailed to go into it, but basically we have a phase-out program. If you're 50, you don't get your Medicare until you're, 70, but you're able to set up an HSA at 50 now, and you have a lot of years to build that up. So we transition out of it in a very fair and just way, and we allow the market to create the efficiencies that it can make, and nobody has to get rationed, and the only rationing occurs by you rationing your own dollars. So that's Medicare. How do we deal with Medicaid? We bring back the role of proper charity. That is, the government usurped that role in 65. And the way to jumpstart that, there's different ways, and I'm not saying our strategy is the best way, but in principle, we say, okay, we will allow a tax credit to anyone that donates to a medical charity that takes care of patients. So the tax credit is very simple because you're essentially saying, well, government, you could tax me and take my money and spend it on Medicaid, or you know what, I want to take that dollar and give it to this local charity who I know is taking care of patients. And that's fine. And so for 30 years, we allow a tax credit for medical charity donations. And we then eliminate it after 30 years because at that time we're not going to need the credit. A deduction will be enough. And, or we phase it out, and you have to just look at the way the numbers go on that. And what happens with Medicaid is we phase that out over 15 to 30 years, but we do the same thing we do with Medicare. That is, the Medicaid recipients gets a health savings account. They manage their money. That'll eliminate these mills that people worry about in terms of fraud and abuse, and apparently does exist. I've not personally been, seen it, but apparently there's about, the government says 20%. The actuaries tell me it's probably more like 7 or 8% maybe in fraud. But when someone gets their own little dollar, they're not going to just go throw it away. Okay? So really, we've looked at the 3 major parts of the market, and we've already figured out how in a few steps we can solve it. And lastly is the medical malpractice issue. And philosophically, that has to do with the non-objective law that's being practiced today. But there's a few simple steps we would do for that. One is that the loser pays. Very simple. Works well in England. And if you take a doctor to court and you lose, you pay their fees. Number 2, we get rid of non-objective damages like pain and suffering. There is no objective basis to come up with a dollar amount for pain and suffering, whether you think it's fortunate or not. Now, currently there are laws that restrict the total amount to maybe $100,000 or $250,000. I have no idea how they can value that. You can certainly value loss of work, loss of life, all other objective things in a claim, but they should eliminate the pain and suffering. That's the second thing. But basically, that's the outline. I did the specific numbers back in 1993 or 95, and I'm working with the same actuary to produce numbers for today, which is amazing. Back when I figured out the plan, Medicare was spending $173 billion. Now it's $550 billion. Had we started our plan back then, we'd be in a very different situation in this country today. And so since we didn't go very far between 93 and now, and it's been a mess, that's why I decided to get active again. And I hope you all join our ambassador program and help us take a rational plan forward. So my goal is in 6 months that with this ambassador program, we'll have a meeting with thousands of people, and we'll have 2 or 3 political candidates that have agreed to our principles, and that this is a plan going forward from doctors in private practice and patients that want to get care. Thank you.